Good afternoon. Thank you for tuning in to the Government of Newfoundland and Labrador's COVID-19 news conference. I'm Leslie Clark with the Department of Health and Community Services, and I'm the moderator for today's question and answer session. Joining us today are the Honourable Andrew Furey, Premier of Newfoundland and Labrador, the Honourable John Haggie, Minister of Health and Community Services, who is joining us via Skype from Gander, and Dr. Janice Fitzgerald, Chief Medical Officer of Health. Please stand by. Our news conference will begin shortly.
Thank you all for joining us for the Government of Newfoundland and Labrador's COVID-19 update for today, March 1st. Dr. Fitzgerald will now give the latest update of the numbers since this weekend. Dr. Fitzgerald.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us. Since the media advisory yesterday, we have 2 new confirmed cases of COVID-19 in our province, both in Eastern Health, both contacts of previous cases, and they are both under 20 years of age. We have also determined that 1 case reported on February 22nd is a false positive, and the total number of cases in our province is now 989. There have been 27 new recoveries in Eastern Health, leaving 236 active cases in the province. There are no new or outstanding presumptive cases. 11 people are in hospital due to COVID-19, and I would also like to extend my condolences to the families that lost loved ones this weekend. 300 people have been tested since yesterday for a total of 112,932 people tested to date. As a reminder, we strongly advise against non-essential travel in and out of the metro area. Going to the cabin or taking snowmobile trips are not considered essential and should be avoided until the risk is further reduced. Travel for work should only happen if the work is essential. If it can be postponed, please do so. If you do need to travel for essential reasons, you do not require permission. However, we are relying on individuals to use their own good judgment and abide by our recommendations. We are still on track to reassess the alert levels for all areas of the province on March 12th. Before we can do that, we need to be confident that the risk of transmission is reduced. So please ensure you are aware of what alert level you are in and what restrictions are in place based on the community in which you live. We need everyone to pay attention to proper mask procedures, particularly in the face of the B.1.1.17 variant. Proper masking is an important part of protecting against this virus. Many of us have found that the mask is also useful to protect us from the wind and snow. The problem is that masks are not as effective when they become wet. So if the weather is poor, please put your mask on just before you enter an indoor public place. Remember that a disposable mask is for one-time use. You can wear it for the full day, but once you remove it, you should discard it. And your reusable mask should be washed at the end of the day. As a reminder, your mask should cover your nose, mouth, and chin in order to effectively protect you and others. A face shield can be worn in addition to a mask, but it is not a suitable replacement for a mask. I am confident that the majority of people in our province recognize the importance of the mask requirement and are doing their best to get it right. Anyone who has a legitimate mask exemption due to a medical condition should, in level 5, avoid entering a public establishment if at all possible. Explore all alternative options to protect yourself and others from exposure to COVID-19. On Friday, Health Canada authorized the use of AstraZeneca vaccine for use in individuals 18 and older. This means the vaccine has met Health Canada's standards for safety, efficacy, and quality. More importantly, the vaccine shows it is effective in preventing serious illness from COVID-19. As this approval is still recent, we are reviewing the evidence from a provincial perspective to determine where this vaccine will fit in our strategy. As announced Friday, pre-registration for a COVID vaccine is now open to those 70 and older. We have had good uptake with over 35,000 individuals registered as of last night, and I expect we will get many more as the week progresses. As a recap for those who may have just joined, we have 2 new confirmed cases since yesterday's media advisory, and the total number of cases in the province is 989. It is everyone's responsibility to prevent the spread of COVID-19. Living in society means our individual actions and choices has impact on others. With COVID in our midst, that impact is amplified and significant. Protecting the lives of others must be everyone's priority. We are all in this together. So hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald. It's a great day indeed, as we heard the news of AstraZeneca, and I think that's a very positive thing for the province and indeed the country as more vaccines become available. Our total number of active cases has fluctuated, but is in decline as each day we see more recoveries. However, throughout Atlantic Canada over the last few days, we have seen COVID outbreaks and the appropriate restrictions applied there as well. Excuse me. These precautions are now taken because of how we know how community spread actually works. Other provinces have seen in our example how quickly this can happen, especially with variants of COVID-19. For all of us, the next few months are critical. Containment, lockdown, testing, they are all working. And I don't mind being the broken record here and saying this. This is not the time to let our guard down. Not throughout the province, and especially not on the Avalon. Be vigilant, Newfoundland and Labrador. And please, be safe. There was more good news recently with AstraZeneca vaccine being approved for use here in Canada, and hopefully the Johnson & Johnson one is not too far behind. Newfoundland and Labrador expects to continue to receive a steady vaccine supply over the coming months. Good news. It's important for everyone to understand that Health Canada has a stringent process for reviewing the science of each vaccine to make sure that they are absolutely safe for Canadians. Over the weekend, my family, as I'm sure many of you did at home, We're actively discussing vaccines and what they did and the differences between them. And as I thought about the trial groups and variants, reactions, and storage, I realized this to explain to my kids. I know there's a lot of us who have the same questions about the differences, but what matters right now is that the vaccines are safe and that they are on their way here to Newfoundland and Labrador. We all need to feel better about that. Our family, my own family, is very grateful that my wife, Dr. Allison Fury, got her vaccine as she's on the front line, and it was safe. Vaccines are our best line of defense in preventing or minimizing the impact of a third or fourth wave of COVID-19. They are the first step in the direction of a normal. For those eligible to register for the latest round, please make sure you do so. For everyone else, I please ask you to be patient. You will get your turn. It's coming soon. So with that, I'll turn it over to Dr. Haggie for a few comments.
Thank you very much, Premier. Day 358 and 236 active cases, a trend we like to see. As I've often said before, and picking up on some of the threads of Dr. Fitzgerald's comments, this is a marathon where stamina and persistence will get us to the stage where we have vaccine available and can get it into arms. Until then, I would ask respectfully that people follow not just the spirit of Dr. Fitzgerald's special measures orders, but the letter too. We have seen and heard of stories, and I accept these could have basis in fact and not. But from my own eyes, the highways were busy this weekend. Essential travel here is the key, and really and honestly, we shouldn't be looking to find a reason to break with the spirit of an SMO simply because the letter may allow you the perception you can do it. We need to follow the guidance and stick to these restrictions until such time as we have sufficient vaccine administered. And to echo the Premier's comment, while we're going through it in groups in order of risk, no one who is eligible will be left behind. So please take that reassurance. We're working hard to make sure our systems will allow for anybody and everybody who is eligible to receive the vaccine. So with that, Premier, again, I would just echo Dr. Fitzgerald's famous catchphrase of hold fast, and perseverance and persistence will see us through.
Well, thank you, Minister Haggie. I'll now open it up to the media for questions.
Thank you, Premier. For the benefit of our speakers, there are 7 reporters registered for today's call. The question and answer session will be conducted in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have 1 final question. Our first questions are from Peter Jackson with The Telegram. Please go ahead.
Thank you and good afternoon. I have a person who left a message on the business helpline and received no callback. I know, Premier, you said that this is still available, but is it actually staffed or is it perhaps understaffed?
No, it is still available, as I said, Peter. Thanks for the question. I'll certainly see that all the calls are being answered. I can't speak to a specific detail, but it is staffed and it is available for small businesses to reach out. We know that individual businesses are struggling during this lockdown, and it's a good chance for me to remind everyone to support local businesses where you can. There are safe ways to do so. But I'll certainly take that back, Peter. Thank you for that feedback and to ensure that all the calls are being answered.
Thank you. And for the Minister, I know we're talking about people being impatient about vaccines and looking for the phase 2 list. But there are some people who feel they are still in the phase 1 category that aren't looked after, and one of them, for example, are private respiratory therapists. Are the vaccines being leaning more towards the health authority staff rather than private staff?
No, the vaccine distribution in phase 1 is based on your likelihood of exposure to a patient who may have COVID-19. We have started through the groups. They are not complete yet, and we said this last week. The challenge there has been the gap in vaccine delivery in February, which has set us behind our time schedule, which, if we remember, actually started nearly a month earlier than we'd anticipated. So we do have some vaccine on the horizon. We're getting somewhere of the order of 6,000 doses per week of Pfizer. There will be some Moderna coming towards the beginning of next week, and then we await AstraZeneca with interest. Once phase 1 is done, that's when we'll trigger phase 2, and that's why we've asked for pre-registration. So the short answer is it's based on clinical proximity to your risk of exposure.
And Peter, just to follow up on the minister's comments, the minister and I will be having a call with the respiratory therapists this afternoon, as I understand it, to discuss further what actions may need to be taken and to address some of their concerns. They're an incredibly important part of the healthcare team in normal times, but especially during an outbreak like this.
Okay, thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Dr. Fitzgerald, you noted in your opening about needing to adhere to the restrictions, particularly when it comes to non-essential travel. We've heard from many people on the West Coast and in Central about the amount of travel they saw this weekend. Mr. Heggie alluding to it as well. A lot of people from the Avalon going out outside of, I guess, that jurisdiction right now. Can you, I guess, give the reminder about what non-essential travel will be, and that just because you're leaving the Avalon you shouldn't be leaving the Avalon. If you're on the Avalon, you're on alert level 5.
Yeah, so I guess it might be easier to say what is essential travel. So essential travel basically is a travel that must happen because of your work. You have to come in to the Avalon, into the metro area to travel for work, or because you need to get medication, or you need to get medical services, or some other crucial part of your life. It's certainly not recreational travel or that sort of thing. That would not qualify, and we certainly wouldn't want people traveling for those reasons.
Thank you. And Dr. Fitzgerald, another question for you. This week, some schools are going back into class, beginning on Wednesday, potentially. For the Avalon and Alert Level 5, student assistants are being asked to go back in for students with complex needs. They've raised a lot of concerns, I've heard from multiple at this point, with what's unsafe for one group of kids. Isn't that unsafe for all? Why there's a rush for everyone to get back? A lot of these students can't physically distance. There is no mask wearing. There's a lack of, I guess, that situation right now, and so they're very concerned about going back into school and questioning why they're having to.
So my understanding with, there are some students that would have difficulty accessing their curriculum from home. And so the provision was made that, if we were in a situation where schools would be in scenario 3, that is mainly online instruction, that those children would still be able to avail of the curriculum through the schools. Certainly there are procedures in place to make sure that, there's screening before these students go in. If there are symptoms, obviously they would not be able to attend, same with the student assistants. So there are safeguards in place to reduce the risk as much as possible. But, these students are entitled to be able to access the curriculum as others would be.
Thank you.
Our next questions are from Mark Quinn with CBC. Please go ahead.
Good morning. Yes, Dr. Fitzgerald, you mentioned that we're on track to review the alert levels as of March 12th, I believe, if I understood correctly. What are the criteria for determining moving to the next level? For example, in the Avalon, what do you hope to see before we can move to level 4?
So certainly we want to see that we're having a steady decline in cases, and that's happening over, many days, hopefully over 2 weeks in general. There may be some up and down, and one day it may be 2, another day it might be 3, but for the most part you're seeing a very low number of cases. We want to make sure that most of those cases are then what we call epi-linked, so we can link them to another case or to travel or that sort of thing, so that we're not seeing those non-epi-linked cases, those ones where we don't have a source. And then we would also want to have a look and, if possible, get a snapshot across the region with some testing to make sure that that what we're seeing in our testing centers is what we're seeing out there in the public. And it's, of course, certainly we want to see anybody who's having symptoms reporting and going in and getting tested. So we'd like to see that our testing numbers are staying consistent, as well as our percent positivity on those testing numbers.
Thank you. And for my second question, I'm not sure who to address this one, so I'll just ask the question, and whoever feels it's appropriate for them to answer, please do. Do businesses have the right to refuse service to someone who refuses to wear a mask?
I'm assuming you're referring to the episode on the weekend, Mark. We really encourage everybody to wear a mask unless there's a contraindication or you have a personal reason why not to wear a mask, for example, severe pulmonary issues or mental health issues. But other than that, we strongly recommend that everybody wear a mask. It is one of the protections that we can apply to not just protect yourself, but to protect everybody else in the general public. So I understand businesses have taken significant challenges, changed their business model to even adapt to those who can't wear a mask. But it's and I would think that I don't want to speak for Dr. Fitzgerald, but we're certainly advocating heavily that everyone wear a mask. And each business, that's up to them. We're advocating again strongly to everybody where you can, unless you have a contraindication to do so, wear a mask.
Our next questions are from Elizabeth Witten with All Newfoundland Labrador. Please go ahead.
Thank you. When the Moderna vaccine was approved, it was noted it was easier to deploy to the province's rural regions on a logistical level compared to the Pfizer vaccine. So how does the newly approved AstraZeneca measure up in that regard?
That's a great question.
Yes, so the AstraZeneca vaccine is what we call a 2 to 8 degree vaccine, so it doesn't have to be frozen, so it can be shipped in liquid form and it can be stored in a regular fridge. So that makes it much easier from a storage and shipping point of view, and certainly is how generally vaccines are shipped and stored. So more in keeping with the procedures that public health is used to. But so it certainly is logistically perhaps a bit easier as to how we can distribute that across the province.
Thank you. And do you have an idea of when the first deliveries of the AstraZeneca vaccine are expected to land here in the province and could be in the arms of people?
So we haven't gotten a definitive date for delivery with regard to AstraZeneca at this point. My understanding is we're still waiting for information at the national level there.
Hopefully soon.
Thank you.
Our next questions are from Noah Shepard with VOCM. Please go ahead.
Hi, thank you. How many of the cases we're seeing recently are the new variant, or are we assuming that they're all the variant?
So we have had 565 cases that have been associated with this outbreak in the metro area, and 88 of those that have been tested have been variant. Now, not every sample is getting tested, obviously, at this point. Previously, pretty much all our samples were getting sent up as they were travel-related, but with this, we haven't been able to send them all. So we're sending a cross-section and picking some of the some of the ones that are of interest to us to have tested. So certainly everything we've sent up related to this most recent cluster or outbreak has come back positive for B117. So our assumption is now that anything that is coming from a community-related case is due to this variant.
Okay. Also, you mentioned earlier about the false positive case. How did you get the false positive, and is it possible that there are more?
No, not likely. So what happened? I can't speak to a particular case and what happened in that instance, but sometimes we will get results that come back that are what we call a weak positive. And when we do retesting, especially if the clinical situation, once public health does an investigation, doesn't seem to fit with, there's no obvious exposure, there's no obvious reason why the person would be positive, the person may not have symptoms to suggest that, then we sometimes will do retests, and depending on what the results of those retests are, they kind of look at the whole picture and determine if indeed this was a true positive or a false positive. And I'm not privy to all of the discussions that happened with determining if this person, why this person was a false positive, but those are some of the reasons why we would see that. So generally it's that we have a weak positive to start with, and then when we do further testing and we look at the clinical situation, we deem that, it's very, that the risk of this being a true COVID-19 case would be very, very low.
Thank you.
Our next questions are from Jason Piercy with Rogers Communications. Please go ahead.
Hi, hello. During the state of emergency that was issued during Snowmageddon last year, we empowered our law enforcement to patrol our streets in an effort to protect us from ourselves and from one another so that we could keep everyone safe. And oftentimes that resulted in issuing fines or for offenses that would be otherwise not chargeable if they weren't in a state of an emergency. What I'm wondering is, under our legislation, have we similarly empowered law enforcement or peace officers in a public health state of emergency? Even though some of the recommendations we're making might not be legislated as law, have we still empowered our police forces to protect ourselves?
Short answer is yes, Jason. We have, under the special measures orders, written into the Public Health and Health Promotion Act a series of penalties for first and second offence. I do know that law enforcement have actually laid charges rather than issued summary offence tickets, which is another option that they, as law enforcement, will be able to pursue. But I also understand that summary offence tickets have been issued. The last number I saw, maybe 5, but I'd have to go back and check.
Okay, would you be able to say, and perhaps it's just not in your world, would you be able to say what those charges would be called? Like, is it public endangerment? Is it, like, what do you call that fine or that charge?
Well, under the legislation, that would really depend on the discretion of law enforcement. I don't know if I actually know the details as to what those two sets of charges would actually be. And maybe justice and public safety would be the best place to go, given the nature of that question.
Perfect. Totally understand. Thank you, Minister.
Our next questions are from Mary Kate O'Neill with the Kicker News. Please go ahead.
Thank you for having me. My question is for Dr. Fitzgerald. Regarding the outbreak in the metro region, what data was collected, if any, in regards to the symptoms experienced by the under 20 age group who were infected?
Good question.
Yeah, so certainly, so one of the things that we noticed, and to be honest with you, Eastern has been very, very busy for the last 2 weeks, so really delving into this data right now to do an evaluation hasn't been possible until the last few days. So, but certainly what we have seen in those under 20 is that the majority of them had fairly mild symptoms, and in fact, quite a few of them had no symptoms at all. And so that obviously is concerning, because a lot of people with very mild symptoms didn't really think it was anything to worry about, and so didn't get tested. And some of them had maybe just one symptom and didn't initially get tested. So we did see that that there were quite a few of the young people who had maybe just a bit of a runny nose or sore throat, or had no symptoms at all. So that's why we lowered our symptom criteria and made it much easier to get testing. And certainly why it's so important to do that contact tracing to make sure we get all those contacts and get them tested.
Thank you. Yeah, and that was kind of my next question. In regard to those specific symptoms, what concerns does this pose for schools returning to in-person instruction? And what advice do you have for these students who will eventually return to in-school instruction?
Yeah, so I think it's really important, and we've changed screening tools too. So, you know, you have a screening tool that everybody has to go through every morning before they go into school, and if they have any symptoms on that list, they're supposed to stay home and see if they need to get testing. So, you know, that has become, I guess, we've had just one symptom now as opposed to fever, cough, or two of symptoms, which is what we had before. And, you know, anytime anyone has a symptom that could be associated with COVID, we certainly would want them to stay at home to fill out the online assessment tool to see if they need to have testing done, and to make sure that, you know, staying home when you're symptomatic is the most important thing that you can do to reduce the spread.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
I'd like to ask about testing. Our testing numbers represent people tested as opposed to number of tests. I don't know how that translates to other provinces, but a number of people have observed that testing in other Atlantic provinces seems considerably more widespread than in ours, particularly in recent days, and certainly before the outbreak. Is there a possibility that we should be using more random testing, or even a wider, casting a wider net on our testing?
Pop-up tests kind of thing.
Yeah, so, I mean, there are some jurisdictions that will test certain groups of people more frequently than they test sort of the general population. So even when we're looking at those number of people tested, some of that is people who've been tested several times, right? So it just depends on what the policies are based, you know, in certain jurisdictions. So those are based on the information that we had, you know, based on the virus that we were dealing with up until this variant. Certainly our policy was in keeping with the science and the evidence. Certainly we're learning a lot about this variant, and as I said before, it sort of changes the way we have to think about this disease altogether, just in the fact that it is more contagious and can spread more easily. So we're looking at all of those things now just to see how we need to adjust what we do going forward.
Okay, thank you. And another question I have would sort of related to mask wearing in public spaces. We don't see hopefully you're not going to see the same kind of mass delusion that we have in other parts of North America and the world, but social media can have a kind of mobilizing effect. Do you feel that if there is any point in which case you will institute more stringent measures if we end up with a bunch of conspiracy theorists and others parading around public spaces with no masks on?
So I think, as you said, Peter, you know, for the most part, that tends to be small here. And I think as far as I can tell, and the little bit that I've actually been able to go anywhere lately, but, you know, it's, I've certainly seen good compliance with mask wearing. And even before the outbreak, I felt there was good compliance whenever I'd been out with mask wearing. So, you know, I think people understand it, and I think by and large, for the most part, people are compliant. So At this point, we plan to keep things as they are. If things radically change in our epidemiology, then those are things we'll have to consider, but there are no plans to do that at the moment.
Okay, thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. I've heard from one mother about her daughter is able to go back to school on Wednesday, but now her daycare is denying her, or childcare is denying her childcare after because she's going to school. What is the recommendation here? Is it if they go to one, they can't go to the other, or are we allowing for both to be able to coincide?
Public health certainly hasn't made that recommendation. However, how things run from a school daycare point of view is not my area. So I think that probably is better directed to Department of Education.
Thank you. Just looking for what the directive was from you. But in going forward as well, for rotational workers, many of them who haven't been able to self-isolate on their own with the new measures in place, their families are self-isolating with them. But now with schools reopening off the Avalon, many of these kids won't be able to go back to school because of the measures put in place with rotational workers. Are we looking to modify them at all, or are these children still expected to stay home?
So I think those are all good questions, and we'll certainly have to deal with those as they come up. I think it's difficult to put in in some situations, it's difficult to put in just a general blanket statement there, as there are lots of nuances to many of these situations. But right now, with the concern with the variant, and as we see more places on the mainland open up, we're going to see more spread of that variant in the community. So we do have to be more cautious, and we hope to have a solution that works for everybody as in the coming few weeks. But it isn't something we can come up with overnight. So we'll have to take those on a case-by-case basis, I guess.
Thank you.
Our next questions are from Mark Quinn with CBC. Please go ahead.
Yes, thank you. You addressed traveling from the Avalon, which is level 5, to areas that are level 4, but we're also hearing that there are concerns that people are coming from alert level 4 off the Avalon to come to level 5, the Avalon, to shop. And we wondered if you could comment on that as well.
Well, certainly, there may be some situations where it's essential for people to come in, if they have to get something from their pharmacy, or if there's certain things they need to get, for special diets or something that they may not be able to get where they are, then I understand that there may be some reasons why people need to come in. But by and large, I think if people are coming in to shop for non-essential reasons, or if they can get what they're looking for closer to home, then they should certainly do that.
Thank you. And my last question, I think you've addressed this somewhat, but people off the Avalon who are rotational workers say that the regulations are forcing them to choose between sending their kids to school or not. Can you comment on that?
So I think I just did to Kellyanne's question. I said we'll have to look at those things on a case-by-case basis.
Thank you.
Our next questions are from Elizabeth Witten with All Newfoundland Labrador. Please go ahead.
Thank you. I'm looking for an update on the status of the whole genome sequencing lab.
Well, I can provide that, Elizabeth. It has been delayed, basically because we have 2 new PCR machines being fitted to the public health laboratory, and both of these are being validated and calibrated this week. The staff that would be involved in the whole gene sequencing activity have been diverted to do that because it was felt by the laboratory director to be a bigger pressure. Once that is done and sorted out, then there will be a resumption of activity on the gene sequencer. Best estimate I have at the moment is the middle of March.
Thank you. And we've now had 2 COVID deaths related to the variant in a very short period of time. And I'm curious, is this an instance of more people being infected statistically means more people are unfortunately going to die? Or is this a sign of how these variants are not only spreading faster, but also more dangerous to people?
Probably a bit of both.
Yeah, so I think certainly we know that if something spreads more and more people get infected, that, you know, in the end you'll get, unfortunately, more people in hospital and more people will die just because of the numbers of people that are infected. But in addition to that, there is some evidence that these variants can cause more severe disease. That evidence is very new. We're still evaluating it, and I don't know that it, there's anything hard and fast at this point, but certainly in our own experience here, we are seeing that people ended up in hospital perhaps a little sooner than we would have expected in their disease course. So I think it is a bit of both. I don't think at this point we can say definitively if it's one over the other.
Thank you.
Our next questions are from Noah Shepard with BOCM. Please go ahead.
We've seen the emergence of a new variant in New York. Are you familiar with this variant?
So certainly I haven't got a whole lot of reading on it done recently, but yes, I am familiar that there is a new variant coming out of the New York area, yeah.
Have any test results recently undergone genome sequencing for the other variants besides the B117?
So when we send a test for whole genome sequencing, it will test. So what it looks at is the genetic makeup of the virus that is being sent. So it's not looking specifically for one variant. It's looking for the genomic sequencing of the virus. So that will show us whatever variant is there. So if it's B117, it'll tell us that. But if it's other variants, it'll tell us that as well. So it's not specifically a test for B117.
Thank you.
Our next questions are from Jason Piercy with Rogers Communications. Please go ahead.
Hi, yes, hello. There was a story that came out of Ontario just recently that they're seeing a significantly noticeable increase in the amount of infants that are being seen at hospital with head trauma, fractures, stuff like that. And there's inference that it could be due to less social worker visits, less family help, less child care issues. I'm wondering if those are statistics that we're tracking or monitoring, and is it something that you consider to be of concern locally?
So certainly that hasn't been brought to my attention as a concern locally, but we do monitor childhood accidents. So if there was a sudden uptick that people were seeing, I'm sure we would hear about that, and that there would be alerts to that. But as of now, I have not had any information to that effect.
Okay, good.
And,
good
Jason,
to know that we're not having that problem.
Jason, just in case, it may be worth noting that the helpline for intimate partner violence or domestic violence is still up and running, and if there are issues, if there's people at home who are struggling with this issue, please reach out for help. The number is 1-888-709-7090, and text is enabled as well. So if you find yourself in a crisis or emergency, please reach out. Again, I'll repeat the number, Jason, 1-888-709-7090.
Wonderful. Thank you very much, Premier.
Our next questions are from Mary Kate O'Neill with the Kicker News. Please go ahead.
My question is for Dr. Fitzgerald. As previously stated, there needs to be more research done with regards to children under 16 being vaccinated. When do you expect to have more information on the under 16 demographic?
So those trials are ongoing right now with with all of the vaccine companies, I'm sure, but certainly with the two that we have in most use right now, the two mRNA vaccines, those trials are ongoing. And but I really don't know the timeline of when we expect to get results of that. The manufacturers would probably be the best source for that answer.
Okay, and taking into account that children under 16 years of age are not getting vaccinated at this time, how can a similar outbreak like the one at Mount Pearl Senior High be prevented among these students?
So I think certainly we've recommended some measures in high schools that would result in a reduced risk of transmission. So with regard to masks, with regard to physical distancing. In addition to that, I think people need to be more aware of their number of contacts and trying to keep their number of contacts low. Certainly with this outbreak, we did see that there was a fair bit of spread that came through, social and sporting and recreation events. So we need to be careful about those contacts as well, and to reduce those as much as possible. There's a lot that can be done, and a lot that we're doing already, and I think then there's things that we can all do on a personal level that can reduce the risk.
Thank you.
I will now go back through each reporter to see if you have one final question. Peter Jackson with the Telegram, do you have a final question?
Yes, one quick question. We hear about rotational workers a lot, and again now they're concerned about whether their children can go to school. They are in a order now such that they have to isolate away from household members, from what I understand. So does that mean if they can't, that their children can't go to school?
So at the moment, certainly that is the recommendation. As I said, those are all questions we'd have to look at likely on a case-by-case basis, and to see what the risk is, where people are, and what the situation is in the school. So all of those things will have to be taken into account.
Thank you.
Kellyanne Roberts with NTV, do you have a final question?
Yes. When it comes to the vaccine rollout, in phase 1, over 85 is listed there. I've heard from a few seniors now that they don't live in a long-term care home. They're still very independent and on their own, or they're with their families, and they're wondering about how they registered to be vaccinated in phase 1. Is it still just through the websites that were released on Friday, and they'll be captured that way, or is there another way for them to not be missed in phase 1?
No, if they register that way, they will be. In fact, that's, the group that we want to capture right now is that over 85 group. We went to over 70 just so that we could, if some areas were ready to move to less than 85 earlier than others, we'd be able to do that fairly easily. So, but yes, anyone who's over the age of 70 can register for vaccination at this time.
Thank you.
Mark Quinn with CBC, do you have a final question?
I do, yes. I'd like to circle back to something I asked earlier. I was wondering if stores have the right to refuse service to someone who's not wearing a mask, and Premier Fury said that right now the emphasis is on encouraging people to wear their masks, but it doesn't quite answer the question of what stores should do. Should they assume that people not wearing a mask have a medical exemption, or should they call authorities to help them? What should they do if they're concerned that someone's not wearing a mask and they think that person should be?
Well, we want stores to follow the public health advice. If they have questions about individuals, I'm sure they have their own protocols. We can't speak for, of course, every business and every store or restaurants are closed, but every store that is currently open. Again, we want people to be following public health advice, and in terms of do they have the ability to refuse, I mean, that would be on them, and hopefully they have protocols in place in order to ask, perhaps as simple as that, do you have a reason not to wear a mask? And oftentimes there is. Like we suggested, mental health issues, severe pulmonary issues, there are reasons not to wear a mask, but we're encouraging everybody, if you can, to wear a mask. But we can't speak to individual businesses and how they approach their clientele.
Thank you. If I could follow up, I think it leaves businesses in a position of feeling like they're...
No, there's only one. You only had one question, unfortunately,
yeah,
Mark.
But Mark, if businesses have questions, they can certainly reach out to the department for guidance, and we'll and it will help work them, through their own protocols to help deal with these. I understand that these can be difficult situations to navigate, especially as people avail of essential services, but they can certainly reach out, and we will try to help them walk through it on an individual basis. As you can imagine, individual stores or individual businesses are different from each other and will often require a different approach.
Thank you for letting me follow up on that one. Thank you.
Elizabeth Witten with All Newfoundland Labrador. Do you have a final question?
No, I'm good, thanks.
Thanks, Elizabeth. Noah Shepard with VOCM. Do you have a final question?
Yes, I do. We've seen Ontario's homeless population been added to the province's list of who is now eligible to get the first COVID-19 vaccines. Is this something the province is considering?
So in phase 2 of our vaccinations, vaccination plan, we do have people who who are in marginalized communities where COVID-19 infection may have disproportionate effects. So certainly people who are challenged with homelessness or who are precariously housed would be part of that group. And so certainly we will be reaching out with our partner organizations in the community to be able to reach those people.
Thank you.
Jason Piercy with Rogers Communications. Do you have a final question?
Yes, I do, please. Thank you. Upon last week, St. Clair's was taking regular outpatient appointments like they always would have been, and this week that's decreased significantly, if not all but cut off. And even though we've only found 2 cases, as was reported, out of that outbreak, is taking those outpatient appointments down to such a smaller amount, is that indicative of a higher level of anticipated spread than our count suggests, or is it simply preventative maintenance?
The criteria that are used for outpatient appointments during Alert Level 5 are based on clinical criteria, so the clinicians will be expected to filter their clinic appointments for those people who they felt could not or should not wait and make arrangements for them to be seen, but to postpone or reschedule those people for whom they felt clinically they could wait a little bit longer. By and large, this is kind of the tail of that process. And I would not read anything into it other than this is the ramping down effect of level 5 activity on outpatient.
And Jason,
okay, thank you,
Jason, I can just add here, having gone through that procedure in the last lockdown, I want to thank all the clinicians for taking the time to kind of scroll through all their patients. It's not easy, I know, and it's often difficult, but Minister Haggie's absolutely correct in the assessment of this is the clinicians looking at their scheduled clinic appointments and seeing which ones could possibly be delayed while we're in this scenario. So thank you to the clinicians out there doing all that hard work and the administrators who are supporting them in doing that.
Thank you very much.
Mary Kate O'Neill with the Kicker News. Do you have a final question?
Yes, I do. Thank you. My question is for Dr. Haggie. Considering that social interaction is fundamental in children developing social skills, what is the plan to assist children in developing these skills safely while adhering to public health guidance?
That is an extremely good question. Unfortunately, you're probably asking the wrong person. That would be better addressed to professional educators and developmental specialists, and they normally would reside either in the education department or with the English School Board, English School District. Certainly, my own experience with my grandchildren is that they seem to have a very active social life. It just involves stealing mom's phone. So it's not the same as face-to-face, I'll grant you that. But kids that age, and they're 8 and 2, they're very flexible. So if you want a more professional approach than a grandparent's answer, I would suggest Minister Osborne or even the school district would be a better place to help you.
I will reach out. Thank you.
Thank you.
Thank you, everyone. Premier, do you have any final comments for today?
Yes, thank you all for joining us. I know that this can be an anxious time for people, but today is a good day. The numbers are going down, the recoveries are going up, and there's promising, optimistic news about vaccines on the horizon. So I heard, and I'm sure many of you have heard, stories over the weekend of mothers and fathers and grandfathers and grandmothers, nans and pops signing up online so that they can get their appointment for the vaccine. This is a positive step in the right direction. I just want to remind people that if you are eligible for this round of vaccines, please make sure you register by your last name. And please do what you can to support local businesses. Virtual classes are being offered in many fitness, dance, music, and yoga leaders. It's a great way to stay healthy, to keep your mental health safe, keep yourself in check with respect to your mental health, and you can do it safely. So please support local businesses where you can. Thanks, everybody, and we are getting through this. We will get through it. Stay safe and look after each other.
Thank you, Premier. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.
This is Jan. Jan sometimes visits her neighbor Paul. Paul has COVID-19, but doesn't know it. Jan also takes the bus. So does Mo, who's a frontline worker. So if Paul infected Jan, Jan could infect Mo, who could infect a lot of people. But wait, they all have the COVID Alert app. So Paul tested positive and entered a code in his app, which anonymously alerted Jan, so Jan stayed home and Mo went to work safely. Phew, close call. Help break the chain of infection. A message from the Government of Canada.